Recording. So good morning, everyone. Thank you for joining us today. I'm Jan Bresch, who is the chair of the Nonprofit Alliance of Northern Shenandoah Valley. And I am going to turn the session over to Larry Weiss, who is the executive director of the Community Foundation, who will moderate today's panel. So we have everyone muted, but if you want to ask a question, you can raise your hand and Larry will go through all of those as to how we can chat with you during this process. So Larry, I'm going to turn it to you.
Thank you, and good afternoon. I hope everyone's enjoying our fabulous food service today. If you have any, just send your comments to Jen at the conclusion of our sessions today. But it is a pleasure to be able to moderate today's Lunch and Learn session, particularly given the caliber of the local leaders who will be sharing their thoughts with you today. Before we begin, I would like to first thank the members of the Nonprofit Alliance Steering Committee for initiating our program today. And those members include Jan Bresch, our chair, Kim Herbstritt, Richard Kennedy, Tricia Simpson, John Lamanna, John Tyson, Dawn Devine, Millie Thompson, Tom Morley, and Darkus Brenneman, and we appreciate their time in putting this program together. Shameless plug time. If you or your organization is not represented on the Nonprofit Alliance, please take a minute to check that oversight. You can learn more about membership in the Nonprofit Alliance, and you can sign up at our new website, which is located at nansv.org. That's nansv.org. Tom Morley and our marketing committee put a lot of time into creating that website. And if you check sign up there, but you'll also find many other resources, both COVID and non-COVID related, on that website. You can also follow the Nonprofit Alliance on Facebook. I know many of you do like and have shared our Facebook page, but if you have not yet done so, we invite you to please like and share our page. So now on to our lunch. But first, just some ground rules. And I know a lot of these are familiar to people now, but since the Zoom session, please let me remind you that everybody except our panelists will be muted. When we arrive at points where we will be soliciting questions or you wish to make a comment along the way as our speakers are addressing these questions, I would ask you to please use the raise a hand function to let Jan or I know that you wish to be recognized.
Larry, I just want to let you know you were cutting in and out.
Okay. So how much was in and how much was out?
More out than in for me,
More
Larry.
out than in, yeah.
You just froze.
Okay, so just a reminder that we are on Zoom. So please, when we get to a point and you need to raise your hand, just do that with the Zoom link and we will look for you as we go forward. So most of you know our panelists, so I will only touch briefly on their many accomplishments. Nadine Patinka has been president and chief executive officer of the United Way of the Northern Shenandoah Valley since 2015. Prior to arriving in our valley, Nadine served as the Director of Development of Baltimore Foundation, where her responsibilities included providing strategic planning, project planning, and management support. Nadine has also worked with the Multiple Dystrophy Foundation and the Girl Scout Council of the nation's capital. Kathy Cantor is Vice President of the Community Foundation of the Northern Shenandoah Valley. Kathy and her husband, Dr. Byron Brill, are also noted for philanthropic support across the valley through their Actarians in District 7570 and through their family fund at the Community Foundation. Kathy has made multiple volunteer mission trips as a Rotarian to Jamaica to provide dental supplies and services to that island. She and her contributor, Kevin Kellen, is the firm serving the charitable sector throughout the Southeast and Mid-Atlantic region. With 3 decades of experience in charitable organization management, Kevin has raised over $56 million for charities in our region. He has worked with present and past clients, including Timber Ridge School, Homewood Retirement Center, Novant Health Foundation, and the Virginia Hospital Center. Prior to forming his new company, Kevin served as Executive Director and Chief Development Officer for the Winchester Medical Center Foundation. Brenda DuPont has been a cornerstone at American Woodmark for 30 years. Currently, Brenda is the Executive Assistant to the President and Chief Executive Officer at American Woodmark. She also serves as the Chairwoman of the American Woodmark Foundation, which she was instrumental in founding in 1985. Since its inception, this foundation has provided over $5 million to our community. Millie Thompson has been with United Bank for more than 4 years. After serving as a branch manager, she is currently the bank's community reinvestment specialist. For the past 3 years, the recently engaged Millie has also served as a fundraiser for the United Way of the Northern Shenandoah Valley. And in case you missed the story, Millie was recently selected as the Association of Fundraising Professionals Distinguished Volunteer of the Year. Only 17 individuals were honored within the tri-state region, with Millie being selected by the United Way for this honor for her tireless service. So we welcome all you panelists again, and thank you for agreeing to share your knowledge and insights with us today. As the COVID-19 pandemic continues, funding is a great concern to all nonprofits. Our concerns include both what is happening now as what will likely happen in the future as this national crisis moves behind us. Today, you'll have the chance to be part of an engaging conversation with individual, corporate, and foundation fundraisers to learn how the pandemic is currently affecting their giving and what they believe will be their priorities and possible changes after the pandemic. Our diverse panel will provide their perspective on where funding stands now, as well as where we can all go from here into the future. So we'll begin with a mini panel as I pose this first question to Brenda, Millie, and Kathy. And we can begin with Brenda, and I'd like you to comment on how has your organization supported the community with funding, and are you still funding as you did last year?
Thank you, Larry. We are still funding as we did last year, albeit it looks a little differently because we are more supporting basic needs like online instruction for the schools, food banks, laptops for teachers, electronic devices for the students. And we actually, in some cases, are having some of the organizations that we have given to reaching back out to us and asking us if they could reallocate the funds for PP&E specific to Winchester. We supported the last minute setup of the emergency shelter over at the Armory for our homeless population and those that were put out due to COVID and losing jobs. So absolutely, we are still active in the community. We feel that our constituents now need us more than they ever did, and we plan on being there.
Great.
And you kind of touched on that a little bit with your answer, but how specifically have you seen your priorities changed as a result of the pandemic?
With the food banks and our foundation board meets quarterly. So we're out in the communities across the country quarterly. And we had, for example, graduation parties and things like graduation parties that folks had reached out to us to support. And then they reached back out to us when those events didn't happen, field trips for the schools, reallocating the money to PP&E and to online instruction. And really a lot of support for basic needs, medical, food, utility bills with CCAP, things that folks would not be able to support that they normally would have, but due to being hours cut or in some cases job loss. Is that what you're looking for, Larry, or anything else?
Yeah, no, that's very good. Thank you. And I'll pose that same question, Millie, to you. You know, in terms of how your organization has supported the community with funding, and are you still funding as you did last year?
Thanks, Larry. Yeah, and it looks a lot different here at United, and I'm sure in the banking industry. For those of you who aren't familiar with community reinvestment, it all stems from government regulation that all banks are required to follow. We have regulators who look at how well you're meeting the needs of your community. So banks are incentivized for giving what's called like CRA, qualified donations and volunteerism to their local communities. And the definition of community development is defined by the regulators. So there's a lot of nonprofits that don't fall in that category, such as SPCAs, a lot of environmental groups, a lot of arts organizations. But what's happened because of COVID is because of the wide impact COVID has made and how much it's put people in need. We have heard from our regulators that they're considering qualifying some donations and organizations now that normally wouldn't qualify, as long as that they can show that the people that they're serving have been impacted by COVID. So that's allowed us to kind of broaden our horizons. You know, we love to support all the organizations, all the nonprofits, but because of this regulation and with our own bank's priorities, we do focus a lot on low to moderate income people, small businesses, projects that go towards affordable housing, such as those. So because of COVID, we are able to reach a lot more organizations now, as long as those organizations can show us and our regulators that the people that they are serving have been impacted by COVID. Also, because of how many small businesses were impacted by COVID, you know, so many of them had to close their doors, they had to pivot. We've been specifically looking how to partner with more small business development organizations. You know, we've heard from a lot of small businesses that they didn't have the technology required to move their platforms online. So we were looking at ways that we could help fund them so they could pivot because of COVID. And then for our priorities, how those have changed, we're always looking to see what is going to be the most need in the community. So we've also been looking at nonprofits that are doing a collaborative effort in the community versus just funding, you know, one nonprofit who's making one smaller impact, versus can we find a nonprofit that's actively partnering with other organizations and they can show us that the money we're putting into is going to have a larger impact. Did I miss anything on that one?
No, very, very good. I'm just kind of curious, since you mentioned that you're involved with federal regulators now in terms of, you know, some of the policies and requirements for community investment. How involved are these regulators at all in terms of actually impacting your funding decisions, or is this still something that is the purview of you know, your local management group?
Good question. Yeah, that's a really good question. Thank you. So your regulator, it depends on the size of your bank. So for United, we are considered a large institution under CRA. So we are looked at a lot more heavily by the examiners versus if you're a smaller community-sized bank, you're not as heavily, your donations don't weigh as much, if that sort of makes sense. All banks have to follow fair lending regulations because the whole point behind community reinvestment was to halt something called redlining. Back prior to 1977, the banking industry used to circle certain minority neighborhoods with a red line and just refuse to lend to them. So that's where the stem of community reinvestment comes from. It's to halt that redlining practice, make sure everyone is getting equal opportunity to credit, and we're just serving those who are most in need. So our regulators, there's also 3 different regulator agencies. So we have the OCC, we're regulated by the Federal Reserve, and then also FDIC. And it's interesting, it's kind of a hot topic right now because the OCC just issued new guidance on CRA, what they're going to qualify, but it's only to those banks that are regulated by them. So there is a little bit of gray area once you get into the CRA world. It's not just cut and dry. It's very subjective. It's based on who your regulator is and what they feel is the interpretation of the CRA regulation. So. Did that elaborate? Oh, we lost our moderator.
Did we lose Larry? Oh, good. Okay. Yes, it did. So
I could talk about CRA all day, but I don't want to hijack the
no. I was sitting here trying to remember who the third person was that he was going to go to. So
Kathy.
I'm gonna bring this up real quick. Who did I give him?
Kathy, yeah.
Yeah, Kathy. So Kathy, can you answer the same question of how are you funding the same? Are you seeing the same type of funding requests? You know what? I don't think Kathy's gotten on.
Yeah, I didn't see her, and I apologize. My internet, for some reason here, just went down, so I connected to another link. So I can touch on some of those questions,
Yes,
in
do.
terms of the community foundation. So, in terms of funding, as we did last year, our level of funding is pretty consistent with where we were last year, although it has come from some different sources. And of course, we do 2 types of funding through the Community Foundation, one of which is through the funds that we manage, and those are the Cochran Family Funds, the Paul and Martha Reese Funds, and some similar funds like that. And those funds are continuing to make contributions comparable to what they've done in past years, although the types of items that are being requested for grant applications are certainly more COVID related than they would have normally been. Where we are seeing a change, quite frankly, is in the amount of contributions that we're making into the community from donor advised funds, which make up a big portion of grants that we would distribute within the year. And the reality is a lot of those grants come from money that comes into those funds through stock distributions and required minimum distributions from IRAs that people find they don't really need for their own bank account, so they're more than willing to pass those on through their donor advised funds to community organizations. And quite frankly, the decrease in those kinds of contributions, reflects where the stock market is and where the investment portfolios of some of these donors and their funds are. As the market has rebounded over the last month or 2, we're seeing that activity begin to pick up. But clearly, as we went into March and April, with the market sliding off the end of the earth, those kinds of contributions dried up dramatically. So that's kind of where the community foundation has been impacted, in this first round of COVID. So as we look into the future, I'll kind of circle back, to Brenda and touch on what their foundation would be looking for, when hearing about projects or initiatives. And this, of course, will help those of you out there who are looking to get projects or initiatives funded into the future.
Thank you, Larry. So the future, we feel that COVID is not going anywhere for a while. We continue to work with the schools with the hybrid program. We have lots of folks who are going to school part of the time and then doing home instruction the other part of the time. So we feel that our COVID needs are going to be with us at least for the rest of this calendar year, likely into next year. So we plan on being there for the online instruction, for the food banks. The American Woodmark Foundation has always wanted to help the greater good, to put our community dollars, and it's, as of today, over $6 million since inception. But we want to help the greater good and support programs that help everyone, regardless of ethnicity. We do want to get back to doing some regular grants, you might say. We're just helping our community with things that growth and expansion as opposed to just COVID. So we do continue to do some of that with a heavy emphasis on, again, across the country, really a lot of food and basic needs, helping folks pay rent, providing support to organizations that help folks pay rent, that help get food, that get medical care, that get food to the kids for summer, food to the kids who are getting online instruction. Again, back to basic needs, but we do look forward to supporting the greater good with all types of projects going forward.
And Millie, do you want to tackle that same question? If your organization is looking to make grants, what kind of projects or initiatives specifically are you looking for, if anything in particular?
Yeah, absolutely. So like I was saying before, we like to find things that are specific to CRA, and that just means primarily benefiting low to moderate income people or small businesses. And also keep in mind, if you think your organization is serving low to moderate income people, how do you know that? Do you have the data to also back that up? Because that's what we need to show our examiners. So it's not enough to just think you're serving low to moderate income people, but also have the data for it. We look that like affordable housing, any services that you provide. Thinking of one recently I was talking to Jan about was about the cancer center, So if there's a specific program that it's not enough to say that you're serving everyone with cancer, but if you have a program that's giving financial aid to specifically low to moderate income patients of cancer, that would work. Programs that are benefiting small businesses or job creation or providing financial literacy. Those are all some of those categories that are hitting our check marks. Like I was also mentioning, was we look for high impact opportunities. So how are you collaborating? How are you making the biggest impact with the dollars you're given, and just being able to explain to us how. We need those metrics. So being able to show our examiner that with the dollars that we gave you, this was the outcome. And also, I think it's important to just be able to explain how you're positively impacting those by COVID, because like Brenda was saying, I don't think COVID's going to go anywhere. So if you do have a program that is helping people affected by COVID, be able to tell us that story. And what I always like to tell people is, just make us cry. Give us your best, your most emotional stories, because those are the stories that we want to share with our employees who are also hopefully volunteering at your organization, and also the stories that we're going to share with our examiner. Like I was saying, the examiners, they're very subjective. It's based on their interpretation. So the better stories we have to share them, then the more likely that they're going to give us the credit that we need. We also look for ways that we have the most robust relationship with the organization. So whether that's business development with the nonprofit, or if it's opportunities to open accounts for your clients or for your staff. It also means, do you have any high impact volunteer opportunities for our employees? Do we have someone sitting on your board? Is there a financial literacy opportunity? I think those are the biggest buckets that I'm thinking of.
No, that's great. And just from the, the community foundation perspective, and I would have to say that, a lot of what you just mentioned, Millie, certainly applies to, how we look at the applications that we get. One thing I would say in particular, and this may or may not be true for Brenda and Millie's organizations and their, foundations and how they're set up, it is helpful, I think, when people are applying for grants through the community foundation to have some understanding of the kind of grants that we have given in the past, both in terms of, what they're structured for, as well as the size, financially of the grant. So there's not a huge disconnect between what we typically fund and what someone's application might be asking for. Typically we're also looking for, an estimation that the number served will have a high impact in the community. And, in general, I think the broader the impact, both in terms of population diversities and geographic diversities, is certainly helpful. It may sound kind of elementary, but, I would caution that many times we see grant applications that are not fully filled out, and questions are not fully answered, and they're left blank. And I'm sure some of you other funders in our group find that this is often the case. And I can't encourage you enough to make sure that you actually fully fill out these applications, and even if it's an NA for a question that you feel that you can't answer or doesn't apply to you, is a better answer than nothing at all. And the other thing I would say, at least in our case, I know, sometimes we see applications where organizations are applying for a portion of the finances needed for a specific project, but to the extent that there's very little information as to how the rest of those funds are going to come into being, it makes us difficult to partially fund something without a strong confidence level that the other $40,000 that you need for that project will actually materialize, and the $15,000 that you're asking us to put in will actually be able to be utilized for that purpose. So that's just something else that I would mention, at this point. Really, maybe, before we continue with just our questioners, to kind of bring some of the others into the conversation at this point. And Nadine and Kevin, you can, certainly comment on this well. And I'm curious to hear from the agencies, and it might help those panelists to know how the uncertainty that we're currently facing in terms of, how long does this pandemic go on? What's going to be required? Are we going to have another shutdown? And in 8 weeks, we've, got this thing now behind us with the curve flattened, or, maybe nothing happens and we just continue in this limbo phase of not really knowing what to do. How is this uncertainty, how are your organizations dealing with this uncertainty in terms of figuring out what you're even going to apply for and where you even go to apply for that? I'm just kind of curious as to what people are facing on their day-to-day situations now with funding challenges. And feel free to.
So you're giving that to Nadine
and well, yeah, we could certainly start, with Nadine and Kevin, but again, any of the agencies now, I know you're all facing that uncertainty of not even knowing what you might even need to do in 3 months.
can touch on it a little bit. Obviously, we definitely have uncertainty here, but I guess I would push back on the notion that COVID will be here forever. It won't be here forever. We will get a vaccine. We will come out of this. So, and I've been challenged to stop saying this is the new normal by Dr. Green from the health department, because it's not the new normal. We will eventually be out of this. So I guess I would encourage, as I do in our organization, to think 3 months from now, 6 months from now, 9, 12, and 2 years. So what does this emergency situation require from us in the short term? But what does it also require us from the long term? So I think this is a great opportunity to look at our organization's diversity in how we are all funded. I know there's a strong reliance on special events within our community. How do we maybe reevaluate that? Maybe how do we relook at that? How do we become more diverse in our funding streams so that if the next emergency hits, we're all better off? So I think there's definitely a time to look for cost-cutting measures, additional grant opportunities, which we've touched on. United Way has a COVID-19 relief fund, so we're also doing some additional funding. So there are additional opportunities. How do we utilize that? Plus the government assistance. So if you didn't apply for a PPP loan, those might be coming out again. Let's take a look at that again. Like, what other support systems are out there that can get us through the emergency situation? But we will come out of this. And how do we all come out of it better? What do our organizations look like when we come out of it? We might look a little different, and that's okay. But we do need to start thinking about what we'll all look like when we have a vaccine and we're not kind of in this instability. And so I guess I would challenge everybody, not that I'm trying to be overly optimistic, because I know that a lot of people are very stressed and very worried right now. So I'm certainly not advocating for that, but I do think we need to think about what we look like in a year and 2 years from now, and how we learn from this and how we grow from this, and what looks different and what doesn't.
While you're, and those are excellent points, Nadine, and particular in, having that focus of 3 months, 6 months, long term, because the reality is the challenges that we were all facing prior to COVID have not gone away. They've only been exacerbated by COVID. So, the need and earlier, we've touched on this in other lunch and learn sessions, just the good governance basics of having a strategic plan and having a diverse organization. COVID only shines a light on that and makes it that much more important that, if your organizations were not well structured, beforehand, and you didn't have a strategic plan in place and didn't know what direction you were going, this COVID challenge has only made your roadmap that much more difficult, but you need to have a roadmap as well. And maybe we could kind of loop Kevin in for the last part of this first kind of phase of the topics, and that is how organizations can set them up for success when pitching projects or need to possible funding organizations. And of course, Kevin, you come to this from both sides of the coin, having been both on the foundation side and giving grants, as well as advising agencies and organizations who are trying to get grants. So what perspective can you share with us today?
Thanks, Larry. And let me add, I agree with Nadine. This is a temporary issue, but when it kicked off in March, I said, and you could see where it was going, I said, what's going to happen is in the next 6 months, this is going to cull out a lot of weak businesses, the small mom and pop restaurants, any type of business that was living on the day by day. But it was also going to call out nonprofits that had not built enough infrastructure and reserves and had good habits of fundraising and business discipline. So, and I think what we're seeing is exactly that. We're seeing small restaurants, small retailers, small nonprofits falling by the wayside because they can't sustain a downturn for 3 to 6 to 9 months. On the fundraising side, let me clarify, I fundraise for Timber Ridge School, and my firm has worked with retirement centers, health centers, hospitals, and other prep schools. And one of the prep schools was actually closed. And it's because they were living day by day. On the funding side, we knew that from March till about June, it was going to be really hard to talk to people. And I don't know if Nadine has seen the same thing, primarily because of the karma. Not that people were sick. We haven't really had an impact in COVID in the Valley. It was more karma. For those old enough to remember, after 9/11, everyone just sort of shut down emotionally. And this is sort of the medical 9/11. Even though there might not have been reality behind it, everyone shut down. The market dropped from 29,000 down to 19,000. Everyone was freaking out. All the foundations saw their assets dissipate by almost a third. So it was more of an emotional COVID than actually the physical COVID. And so even when I've been fundraising for Timber Ridge and working with other health systems, what I found is from March to about June, people just didn't want to talk to you. They were sort of freaking out. Now, here's the good news. That's not true anymore. People are able to be engaged. The market's back up to 27,000. It's almost 27,000 today. I think people are starting to feel better. And if you take a walk on the walk-in mall, you'll notice a lot of people on the walk-in mall. You'll notice the restaurants are getting busy again. You go into retail stores, people are going into the retail stores again. If they have to wear a mask, but they're still going in there. Go to Costco on a Saturday, it's looking pretty darn busy. So I would tell you, while we have physically gone through COVID, we're now emotionally coming out of COVID. Even though it's still out there, we're starting to see a return to a norm in the first phases, sort of the very quiet phases. One of the things that you said was, are you still finding funding versus last year? No. Clearly, second quarter was a down quarter. My first quarter for all my charities was up, but second quarter was in the tubes. Third quarter is going to be a rebuild, but I expect us by the fourth quarter actually to be back to our norm in the funding area. And a key that I'd like to share with everybody is this. You've got to call your donors. You've got to call your partners. You've got to set meetings. I think a lot of people are terrified that no one wants to meet. I have not found that to be true. In fact, I just set 5 face-to-face meetings this morning. People are ready to get out. People are ready to talk. People, and they still had those same budgets allocated. So don't miss that opportunity. Projects and initiatives, I would recommend everyone stay the course with what you do. So if you're NW Works, don't try to change what you do to reflect COVID. Stay true to your mission, stay true to what you do. The last thought that I had was on special events. I know many people that are tuned in today live and die by special events. And I agree with Nadine, this is actually an opportunity not to kill events, because events are a great way to say thank you to your donor, but to change the MO from where you're raising money to the event rather than thanking donors. It's really important that events become more donor recognition than donor ask. And if you do that, that might be the one healthy thing you can do during COVID that will actually set you up for the long term. As some of you know, Valley Health, when we started Valley Health 15 years ago, they were raising about $250,000 a year, and it was all event driven. We shifted to a major gift, annual gift model. I think last year they raised over $5 million. They're on pace to do that again this year. They still have events, but that's not how they make the money. And we don't have enough time to discuss that in detail. But I would say this is a great time to rethink how you touch base with those companies and individuals and grantors that really love you and have been funding you in the past.
Yeah, and I'll just add, and Larry, if I'm skipping ahead, you can just cut me off.
No, go right ahead.
I'll just add, like, now's a good time to shore up your story too. You know, I think funders are really willing to be flexible right now. They're listening more than they ever have. I think funders also want to meet the needs that of the nonprofit organizations and of the community. So again, I would shore up your story, and if it's me you're talking to, I want it as honest as possible. So don't pretend COVID never happened and la 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 la, everything's fine, because you think a funder wants to hear that. Funders know that's not the case. We are all struggling right now. We're all having to adjust the way that we do things. So shore up your story, whatever it is. If you had to close for a certain amount of time, make that work for you. You know, you had to close because of, you know, safety concerns, and you were able to save some money here, but now that you're reopening, like, what is that story? It's all going to be unique. We never shut down. We have a unique story. Our demand is increased. So I'm actually working more than I ever have. So, you know, I think that's all part of our story. It's all different for everybody. And I think funders want to really hear what the impact was on your organization in a very honest and real way. And if you have been serving clients, or you serve clients who have been impacted by COVID, again, I mean, I say it till I'm blue in the face at United Way. It's outcomes, 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 outcomes. You still got outcomes. So what are they, or what do you project them to be? As you know, everything is pre-COVID, during COVID, and post-COVID, right? Like everything in our lives right now. And so I would take a look at your organization and kind of look at it like three separate stories. What was happening pre-COVID, what happened during COVID, and what do you project to happen post-COVID? And be really honest with your funders and make sure you know that. I had a organization ask me the other day, they wanted to convert an impact grant to a operational grant, which we're not opposed to necessarily doing. But when I asked them all the questions, okay, what has the impact been on your organization? They couldn't give me any real numbers. They couldn't really tell me what their lost revenue was or anything like that. So a funder's not going to be flexible if you're also not providing them with the information that they need in order to make a decision in your best interest. So make sure that if you have some time to kind of shore that story up and really make sure you've got your talking points, I think that's really important as we move forward and as funders are looking to help in any way that they can.
Nadine, that's great advice. And being a funder on behalf of our foundation, we want to support you in the same fashion that we supported you before. We just realized that we're doing business differently. So to your point, we've actually had a few of our organizations reach out to us because they've taken events virtual. Jan, for the Special Love, Camp Fantastic has gone virtual. For the Children's Make-A-Wish, they're doing virtual things. Last or 2 Saturdays ago, the Rubbermaid sale for the Concern Hotline, I went out and volunteered for that for a while. They realized that with the fish fry being a drive-through event this year, they're going to have to raise money in other ways. So we want to be there. We appreciate the creativity, and we've actually done a few Zoom meetings to stay in touch with our constituents to see what's going on in the community, knowing we want to support those same things. They just look a little differently this year. Right.
Yeah, I would also add, you know, speaking for United Bank company-wide, which is 7 states, DC, not talking about Winchester specifically, but we've actually seen our donation requests down. And I think it was in large part because a lot of nonprofits, they didn't know how to pivot during COVID. And because they relied so much on special events got canceled. Therefore, we stopped getting asks to give money out. And one of our biggest struggles on a funder side was communicating with our partners. We have some very strong partners where we have an employee who sits on the board, and we've maintained that strong level, open line of communication. But a lot of our partners, we stopped hearing from them. Maybe it was because we interact so much with our partners through volunteerism, and volunteerism kind of became on hold, and nonprofits hadn't quite figured out how to pivot to virtual volunteer events. So from our funder side, we did see a decrease in our asks, and we didn't hear from a lot of our partners. And to everyone's point, yes, we need to hear these stories. We want to know how you're doing. We want to know how we're going to help you meet your needs, because we're all in it for the same reason. We want to help, and you know, we're incentivized to help by our regulators, but we still have to be able to show the data behind it. So our regulators need it.
Great, great.
Larry,
Thank
I'm
you.
going to jump in for a minute and just say, Brendan mentioned that our Camp Fantastic, which is our camp for children with cancer, has gone virtual, which is all next week. But we just came off of a full month of our camp, which is usually a week for the siblings. It ended up lasting a full month. We took all of our in-person programs virtually in March. We quickly turned it around and came up with a concept for that. And we know that we will be doing that through the end of the year, probably the beginning of the year. But when you talk about, still go out for your programs and what is your story, as Nadine said, your story, all of our things are still there. But what has come for us is we do emergency financial aid, and we know how much a year we generally give out, and that's what we budget. We exhausted that budget in June because our families are coming out and saying, we have nothing. We need to keep the lights on. We need to pay our rent. We need a car payment. And we have seen a dramatic increase this year in asking for funeral expenses. We have a limit that we give for families who've never been part of Special Love, and we have an amount that we give to those who have been part of Special Love. We went outside our norm because this is not a norm situation. We had a mother whose child had been in the morgue at the hospital for 10 days because she couldn't afford a funeral. We paid for it. We paid for that child to get out of that morgue and that mother to lay her child to rest, because you have to do that. You have to be able to pivot and say, where are we most needed right now? We're going to do our in-person online, but where is the most need? And that's what you have to share with your funders. Not as necessarily asking for that funding, but to say, what are we doing right now? What's happening with us?
Good, thank you. So a couple people through the chat box have asked, and I would ask any of our panelists or anyone participating who'd like to comment on this topic to touch on, if you can, how COVID has challenged you to communicate with your potential donors. In this digital age, our email boxes are getting full every day, and what's the best practices for maintaining communication or communicating a message through this current environment? If anyone had any suggestions to answer that.
Yeah, Larry. So one of my clients, Novant Health over in Haymarket and Prince William, as well as the North Carolina Health System, is trying different models to engage response from their constituents, their donors. Some with more success, some with less. They've really been ramping up their communication through Facebook and LinkedIn, and that actually seems to have a pretty positive response, especially if you personalize it to the donor, whether it just be a posting or a celebration. They've really ramped up. They now have an email newsletter that goes out to all the board. I have a hard time really telling whether that's having an impact, because when you blast out an email newsletter to 100 people and you don't get one response back, that normally bodes ill. It's like, well, it's going out there, but is anybody responding? No one's even sending back emails like, hey, way to go, good email, or something like that. Now, I think right now, a lot of people are looking at the panacea of doing blast email updates, Zoom teleconference updates. I will tell you that I think that's actually had the least amount of impact. We did Novant, they got really into this. They did a 3,000 person invitation to this big communication about what the hospital was doing in the area of COVID. They had 120 people register. So I think that's like 0.0000008%. Not a really good turnout. And that was their biggest donors. They're people that are most supportive of the foundation. But when they go on Facebook, they get a lot higher hits. So it seems like, in my mind, Facebook seems to be doing really well. LinkedIn seems to be doing okay. It's a business model. Emails, but also don't forget the basic things. If you can't visit with your donors, pick up the phone and call them. They will love that. They will value that. Don't be so sold on electronics that you take away the human contact. And that goes right back into the consideration. I'm sure there's a number of people right now listening and going, well, I'm not going to call anybody because they don't want to meet. That couldn't be farther from the truth. There might be 5% of the people you call that are maybe have a comorbidity or they have a loved one who's sick and they don't want to meet. But the large majority of people in the Valley who have not been impacted by COVID, who haven't lost a loved one, haven't had a loved one sick, they're ready to get out. They are starving for human contact. And it's great to be part of that group that actually re-engages.
I am so glad that you said that. It is so true. It's back to basics. I think because we can't get out and do the after hours where I'm so used to seeing all of you lovely people, it's kind of strained our relationships, and it's all personal relationships. That's what it comes down to. Even from our banks, you know, whoever your point of contact is at United Bank, whether it's the market president or a branch manager, you know, you have to stay in communication with them more through the picking up a phone call or scheduling a Zoom if you have to. But we're missing the personal touches, definitely. And I see that with all of our partners.
Larry, could I make a comment about our financial institutions? Would it be okay?
Absolutely not.
I want to share two things. One, just well,
No, we did it anyways.
Yeah, well, we do that. So.
Never mind. I'm muting right now. Really seriously, you do need to remember that all the banks are still closed. That they're still not. That they're doing everything online and they're doing everything through the drive-through. But they will take appointments. Is First National Bank open back up?
First Bank, yes. First Bank is open every day from 10 to 1.
Oh, good. Good to know. As a stockholder, I'm pleased by that, Darkus. but also you can reach out to the bankers and you can visit off campus. They're really open to community, and they have that CARES Act that Millie talked about that they have to support, and probably are feeling a little pressure right now. So.
Yeah, so I would also just mention, you know, all banks are open. If you do need banking, if you have needs, contact your banker. It's, if anything, a by appointment only. So you just have to let them know you're coming, but the banks are open. You can do your banking. You know, it just looks a little differently now. You just might have to call ahead before you head over.
So Millie, it's really weird to go into a bank with a mask, but I've done that. And I am going to say that one of the hardest things, if not the hardest thing for us, has been, I see all these names. I see Robin, I see you, Mark, John Lamanna, all of our friends, Jan, that we normally like to see face to face, and we go out and we attend the camp, and we want to go to the sheriff's camp for the kids. We want to present our grants face to face so that we can see you and express our love for the organizations and our community. And unfortunately, with COVID, we decided that it would be best in everyone's best interest to mail the checks, to make that phone call and let folks know what the grant was, but then actually mail the check. I told my team recently, I'm hopeful that this fall, our next grant cycle is in October. So we would be out late October, early November. I have my fingers crossed that we can get out into the community then. We'll see what it brings, but please call us and let us know how you're doing. Be happy to set up a one-on-one with you.
Great, thank you. I'd like to circle back to something that I think both Kevin and Nadine mentioned earlier, and that is, and Kevin, I think you actually gave a statistic. You know, we know that a large number of small businesses, both nationally and certainly within our community, are going to be impacted. We know that a lot of agencies depend on that support from small businesses. So to the extent that we lose 20% of the small businesses in our community that have been supporting nonprofits, you know, where can we go to replace that segment of funding, and what ideas might people have for how we meet that challenge? And any of our panelists can weigh in on that, or any of the rest of you who were enjoying our session today.
Nadine, do you want to kick that off?
This will be an impact.
Sure, yeah. Well, I think one strategy, like I mentioned at the beginning, is just to figure out how we can all work more efficiently, right? So there may be ways to reduce expenses. There may be ways for organizations who do similar things to join forces and to, I know merge is a dirty word. No one likes to talk about it. But ultimately, you know, again, maybe this pandemic is forcing us to look at how we can be more efficient and work together closer. And so from the nonprofit side, I don't know about the business side, you know, I do see a strategy of certain organizations kind of banding together to reduce their overall expenses so that they don't have to fundraise as much and they're able to sort of take that loss through, you know, sort of figuring out how to be a little bit more efficient, work more efficiently with other organizations, or even merge if that is, I don't know why that's a dirty word, but it seems to be. But if it makes you more efficient, it reduces your expenses and more money can go to your programs into the community, I don't see why it's a bad thing. So, so that's certainly an option. You know, I think I liked what Kevin said about figuring out how to do events more efficiently and utilize maybe like one event per organization instead of spinning wheels and really doing a ton of them and really putting that effort into communicating that story, shoring up your outcomes so that you can you know, apply for grants and you can be more successful in that arena by utilizing that time to do that. And I will also say, you know, I think a lot of organizations don't qualify for certain funding because of certain audit requirements or certain governance requirements. So like Larry said, and we mentioned at the beginning, use this time to figure out how to shore up your governance so that maybe you do qualify for different kinds of funding that you didn't qualify for before. So if you need an audit, you know, figure out maybe you've got a donor who's willing to help you pay for that audit so that you can qualify for $50, $100, $200,000 more in grants, whether it be the federal government or a private institution. So I guess those are some of my like high level tips.
Anyone have anything to add to those?
I agree, Nadine. I think that's really, really important. And I would tell you that if you're a charity that literally makes money in a month and spends the money next month, and that has been your MO for a year plus, you need to think about a new model. And it could be that there's 3 different nonprofits that do the exact same thing. And I know the ego comes into it, the board, and what about a job and stuff like that. But organizations that fail don't do anybody any good either. So I agree with Nadine. This is a time to sort of really do a gut check. Is my charity sustainable? And that means that you have enough money to fund operations without another penny coming in for 12 to 24 months. If you're not sustainable, that's I think incredibly important. So really, really good point on that. I would tell you also one thing is when you're talking about funding, so many charities do not ask their family first. Take an honest look, say, okay, we need revenue. 5 or 10% of the small businesses are going away. Now, the good news is most small businesses are not big donors because small businesses are living hand to mouth. They don't have a lot of money to share. So we're going to see those small restaurants, maybe small hotels, event centers, people like that going away in the short term. They'll be replaced, but the ones that go away probably have not been your big donors. But you need to use this as a time to solicit and engage face-to-face in an honest conversation with your board members, your past board members, those donors that have given to you every year, and you need to get them involved and get them engaged. So many charities that I do audits on, I find half the board doesn't give. And I'm not a big fan of the give, get, or get off. I don't like that. I think that cheapens who we are. But I do think it's worth a healthy conversation with every board member, with every member of your staff to become a charitable donor, and then go out to those people that you partner with, your corporate partners. You do business with a lot of banks. You do business with vendors that supply you with stuff. Those are people you should be engaging to be a donor and be an ongoing supporter of the charity.
Thank you. So, and again, I'll toss this up there for any of our panelists to comment on how over the last couple months, due to our pandemic, the relationship with communities and funders has been affected, because clearly it has in a number of ways. So if anyone wants to comment on that, please do.
Larry, I think for us, the relationship has been affected, again, to my point of we like to go out and visit and see one another and interact with these organizations, and COVID has prevented us from doing that. So we have to get a little creative and set time aside for that cup of coffee, that Zoom call where you can actually see one another, so that these organizations give us a feel for what's going on in their world and how we can help, because we want to help both financially. And at American Woodmark, we have many people who look forward to getting out and volunteering. I was on a call this morning with, at American Woodmark, we have a Right Environment Council. That's our employees collectively get together and they form teams. And I was talking to one of the members of our Right Environment Council, and she asked me if I was aware of any need where there's volunteerism that we could help and be able to do. The social distancing has made it a challenge somewhat. But I was really pleased with last Saturday, a week ago, the Rubbermaid sale. We had masks on. I thought it went well. So I do agree that folks are getting back out, and we are meeting some folks face to face and trying to social distance, and it seems to be working well.
Thank you. I know,
Yeah.
Nick, you know, the United Way being on the front lines always, because, you know, when people think of relief, that's just, you know, United Way is so well branded that, you know, it becomes top of mind for people. How have you been dealing with that whole changing relationship with the community and funders while you're trying to go about responding to all the need that people are approaching you with?
Yeah, I mean, I've actually been really pleasantly surprised. We have a lot of people wanting to help right now, and I think that's great, and I think that speaks to the spirit of this community. So I do have to say that when we started our COVID-19 relief grant, I mean, or relief program, it was just like immediate. And retirees, I mean, half of those donors were retirees. So don't forget about your retirees. They are seeing what's happening in our community. They're seeing people get laid off, and they are wanting to help. So I think, to Kevin's point about the meeting, I do think people want to help. I think we assume that, you know, people have lost their jobs, and there's a lot of that, but there's still a lot of people who feel very fortunate to have a job that are still giving. In terms of changing relationship, I think one good thing is that, you know, we have just opened up that line of communication with the organizations that we do fund to try and figure out how we can meet immediate unmet needs. And that COVID-19 relief fund was really meant to do that, was to be a little bit more flexible with our funding, make sure it was immediate, that it went out quickly without too many strings attached. So that's a little different than our usual model. And so I think a good thing that's come in terms of changing relationships, I think that funders are willing to be flexible. They're willing to meet needs that maybe they haven't been willing to before. We've had funders who have reached out to us and have given us money for specific things and just said, use it for whatever you need it for right now. And I think that those things are all really positive things that are coming out of this. So we continued our fund distribution, even though it was virtual. So we just tried to work those agencies through that and, you know, just sort of manage expectations, but it was still important that we got that money out there. And, you know, I don't know what the fall will bring in terms of our funding. I, again, generally am optimistic that a lot of the companies that support us in a big way are still working, and hope that they will be able to pull off a campaign and will help us be able to sustain this little blip on the radar. So I do agree with Kevin. There is sort of that sense of like, there's people are overwhelmed, I think, with the uncertainty of the future. So it's not necessarily top of mind to funders or to donors, but I think that's where it's our job to continue to demonstrate what the need is and how we're all trying to meet that need, so that people don't kind of retreat into Zoom land and forget that there is a whole world out there, many of which are struggling through this time, and all of us are really working to support those folks. So it's our job to keep that top of mind in a positive way, but yeah, keep that communication open with your funders, because they may not necessarily have it top of mind, but I think when you reach out to them, they do want to listen. And so far, everyone we've talked to that we have reached out to because we've needed help has been super responsive. So.
Great. Great, thank you. Now I'm curious, because we have over 20 representatives of nonprofit agencies on our call today and participating in the Lunch and Learn. So be curious if any of the agencies on our Lunch and Learn want to comment on how they have been dealing with the change in approaching the communities and funders, and might have some suggestions to pass along for something that they've done over the past couple months. And I would share that with the group.
I'll jump in. This is Cynthia Schneider, top of Virginia Regional Chamber. Two things come to mind. One, I want to encourage all of you who have such great works that you're doing, is to remember that when you're making your ask, you're not really asking for money, you're not begging. You are offering the opportunity for our businesses to align themselves with your mission and to show the community the values that they represent in their organization. And we really see that in our membership, that folks really want to align their business with a good cause, with a good mission and purpose that serves the community. So really, you're really giving them the opportunity to market their business or their business alongside your mission, which is a very different way to think about that. And then to make it really simple to give, I think a great example of this during the pandemic was NW Works did a call to action asking for people to just donate, I think it was like $25 to $50 to help buy shoes for their clients who they were trying to get back out into the workforce. So it was a very simple, clean ask and very manageable for most people. And it was, just was a really good feeling to know that not only were you giving, but giving to get somebody back to work. It just met all of the needs. So I'm sitting looking at many of your organizations thinking of, if I knew you just needed that $25 or $50, I'd jump on it in a heartbeat. And that just adds up to great dollars for your organizations.
Pat, I see you have your hand up.
Yeah, first of all, Cynthia, I think that was great. If there's anything I take out of here, it's going to be, don't ask for money, but offer people and businesses the opportunity to share our vision. I just think that's a great message. The other thing I heard both Larry and Nadine talk about, I heard Larry talk about the RMDs, required minimal distribution, and Nadine talking about retirees. And probably everybody is aware of this, but I think it's important that we get the message out that when people do their RMDs, that they can designate money towards a certain nonprofit, and they're not taxed on that portion of the RMD. And I think that's a good sales point, because it's a kind of a back-end way to lower your taxes, and a lot of people aren't aware of it.
Thank you. Anyone else?
I just wanted to add one thing that might be slightly off topic, but it's something I've been thinking about during this pandemic too. I think it's a good opportunity for us as nonprofits to talk about what overhead means, right? And what it means for an organization to be sustainable through a pandemic like this, and beyond, right? So talking about the people that work there, and typically that admin portion of people's donations, again, nobody likes to talk about that, right? But you see organizations that are thriving through this pandemic, and they really, like Kevin said, have a solid governance structure, have a plan for operational reserve, and have some solid overhead. And so I think it's kind of all of our opportunity to also talk about what that means for an organization. Not that any, because I know none of us have crazy high overhead, but even, there's a lot of like, who has the lowest, and it's like this competition. But I think it's just a good opportunity for us to talk about what it means to have a solid infrastructure, and that really at the end of the day, that benefits the donor and the community to have that. And what that all means for us as really an industry is to talk about that during this time. So just something I'm not real eloquent on yet, but I've been thinking about as I've seen certain organizations struggle during this time and others not, and have been able to pivot quickly. And it makes me think about which ones have that solid infrastructure, and how do we communicate that to donors, that at the end of the day, when something like this happens, really benefits everybody to have that in place. So just a thought.
Great, thanks. So we're kind of heading into the last little segment of our Lunch and Learn today, and kind of want to take a little different look and maybe flip the coin over. For the last few minutes, we've talked about a number of different suggestions, obviously, and maybe I will toss this out to our panel and again kind of look at the other side of the coin, and whether it's COVID-related times or normal operating times. We've talked about a lot of great ideas and some best practices. What are some never do's? Like, don't ever do this, whether you're trying to find funding in a COVID pandemic or, in normal times. What kind of suggestions might you toss out to our groups of some never do's? And
I would, the first thing that I think about is maybe not quite a never do, but if we've ever funded you before, make sure you always thank us and follow up with us with what the outcome was, because then if you ask us again and you didn't provide that, your chances are less.
I would agree with Millie on that. One of the things through our foundation, again, we're nationwide in many communities. We are an employee-run foundation, and we have small committees. And when we issue grants, in the grant letter, we do ask that you send us what we call an acceptance letter. That is our formal thank you. It doesn't feel good when we have to go chase those acceptance letters down. We develop the relationships. We like to be transparent. So when you're coming to us, be open, be honest, be transparent, tell us what your need is. We do want to help, whether it's COVID related or not. We support since the beginning. Areas like education, domestic violence, fire and safety. We continue to support those in any way that we can, but be transparent and show us your appreciation.
Great, thank you. Kevin, I'm sure you have some suggestions for things never to do.
Larry, I'm not sure how to take that. I actually, John and I were talking a second ago. The first never is when someone makes an offer, never counter. I actually had a $1.5 million donor make an offer during our cancer center campaign. And my CEO at the point said, "Oh no, they can do more. We're going to counter." And the donor had said, "Don't counter." We didn't listen, and we lost $1.5 million. I still cry over that one every so often, but I still weep. I would say never put your needs above the needs of the donor. And what I mean by that, and it's not as true with foundations, but if you care more about the donor, the individual donor, or the business donor, or the corporate donor, if you care more about how you're serving them than how they're serving your mission, they will care more about their mission than their own business. So it's like a great marriage. The best marriages the husband cares more for the wife's needs than his own, and vice versa. It's the same thing in philanthropy. If I partner with First National Bank or United Bank, I'm going to try to do everything in my power to help them grow and do well. If it's an individual donor like Jan or Nadine, I care more that they feel good about this gift and that they see a value to it than our own benefit. I have found, because I used to run the charitable budget for Valley Health, I had multitudes of small charities come in and say, we need the money for this, and this is why we need it, and give it to us now. And never did they say, how can we help Valley Health? How can we be a benefit to you? And because of that, I was less engaged to support them because they didn't give really, we were just a big old hunk of money for them and that was it. And a lot of times small charities think that way. Think about when you visit Robin Cardillo and you ask Robin for money. Learn about Robin, learn about what her needs are, learn about what her cares are, and find ways that you fit. And sometimes if there's no fit, walk away. Larry is dumbfounded by that comment.
No, I mean, obviously I'm new to the nonprofit world, but no, business success is all about setting up win-win relationships. Nothing works well in the long term unless it wins for both sides of the equation. So those are very timely advice.
Well, you're a great example of that, Larry. Remember the relationship that you and I constructed during the cancer center. Hopefully it was a win-win for both the radio station and the patients that were receiving cancer care and the cancer center. Try to always think those ways. How can you be a good friend to the bank or the radio station or the retailer or the restaurant? How can you serve them? And then if you do that, you'll build a great long-term relationship. And that's the key to good fundraising, is not soliciting once and walking away, but engaging them annually, year in and year out, and being a good friend and a good servant, what I call the servant fundraiser to those for-profits that are helping you make it through the day.
Wow. Well, you know what? It kind of looks like the moderator planned to have that great recap at the end of our session to kind of put everything into a great perspective and takeaway for people, but that wasn't planned. But we still do have a few minutes left. So before we conclude for today, does anyone else have a question that they would like to raise to our panel, a point of information that they would like to share with the group, or just some other comment related to all the various suggestions and points that our panelists have touched on today?
Hey, Larry, can I jump back to the question from Suzanne about digital? How do you keep in touch digitally? I'm going to give one thing that I learned quite a long time ago, and I've been doing this many years. When you send a message, whether you're doing it digitally through Facebook or email or LinkedIn, keep it brief. Get to your point right away and have a compelling picture with it. Nobody is going to read past that first paragraph. You see a lot of things go out that they're this long, they've stopped reading. So you need to have your point up front and have a picture and make it compelling and make them want to come back and ask you more questions.
If I can add to that, give me the link to where I can make the buy. Right
Exactly.
there.
Yep.
And if you go back and look at NW Works campaign on getting the shoes for those workers, it was done in 60 seconds, maybe less.
Right.
So give me the link and I'm going to give.
Yeah, because clearly in this day and age, people are looking for convenience, and we need to be able to provide that to them. Absolutely. Any other comments or questions? I'm kind of trying to look around off a couple.
I know the topic today was based a lot on funding, but I would also stress the importance of finding volunteerism for our corporate employees, for your donors. We have to find a way to engage our employees with your organizations. And I know it's a struggle to find the right kind of virtual volunteer opportunities, but I would also stress to make that a priority as you're thinking about funding, how you're going to engage your volunteers in the short term.
That's a good point. I will tell you that a number of our funders who do our camps, and like American Woodmark, who actually comes out and stages an event at our camp each year, we've engaged them to come and do something virtually, whether it's a quiz night, whether it's a dance party, whether it's an arts and craft or whatever, that it gets them something to be involved and still get to interact with the kids. And so they're getting what they need. They want that feeling of being close to the families and what our mission is. And that's a great way to keep them connected. So any little thing that they can do to come forward and volunteer, it takes it off of you and it gives them something to do.
Yeah, and I would also add to make sure it's still meaningful.
Right.
We don't want it to just be a waste, not a waste of time, but it's one thing, it's busybody work is different than actually utilizing our skills as bankers to do something that we feel we're really helping you. So just keeping in mind how to utilize our skill set to best benefit. So it's mutually beneficial for both of us.
Good point, Millie. It's
People
not
hate to volunteer for something and then get there and not be utilized at all and find that it's not organized and maybe they really didn't need me. And yes.
Yes, I hear those stories and think about not, that's a lost volunteer. What are the chances that they're going to want to volunteer again? Maybe not even just for your organization, but if it was their first time volunteering ever, you just kind of set them down the path that they never want to do it again. So always make sure it's meaningful.
It's not about us, it's about you, and we want to make a difference with the people that we're interacting with.
Great. Nadine or Kevin, a closing comment? Great. Well, thank everyone for your time today. This has been a very enlightening session. It proves that these things can be successfully done via Zoom, despite a few little internet hiccups across the way. And of course, we apologize for those, but they're Comcast's fault. So, there's not a whole lot we can do with that. I hope everyone enjoyed their lunch. Thanks again to Nadine, Brenda, Kevin, and Millie for participating and being our panel today. Thank you all for joining us. And again, if you have not yet visited the new website at nansv.org, I encourage you to do that. And if your organization is not yet represented in the Nonprofit Alliance, shame on you. You need to join. And with that, I will bid you all adieu and thank you for your time today.